Hello and welcome to another instrument class. Let's start with the bulb syringe. This is also known as bulb sucker, which is used for nose and ear care. It is made of soft silicone and it is safe and prevents damage to sensitive areas. It is around 11.5 centimeter long. It has a soft nozzle over here and there is thread like patterns, and then this is a suction ball. The procedure how this is used. So you need to squeeze. When you squeeze, you remove the air and place the tip of the nozzle in the nostril or ear of the infant and then release the bulb. So when you release the bulb, you create a suction. So this is effective and it clears the mucus and congestion without causing any discomfort to the child. Next instrument is Foley's catheter. So this Foley's catheter is usually used to drain the urine. This catheter has two ends. So this end tip, it contains one opening here and there is a balloon. So this end is inserted to the urethra. And then another end, there are two openings. One opening is for urine drainage and another is balloon port. So where you introduce the fluid and then you inflate the balloon to fix the catheter. This is available in different types. One is two-way Foley's catheter, another is three-way Foley's catheter. So two-way Foley's catheter is these ones. So it has a channel to inflate balloon and another channel you drain the urine. Whereas in the three-way there is one extra opening. So this additional channel is for irrigating or for the irrigation of the urinary bladder. This is available in different sizes. So depending upon the age, you get different sizes and then different colors are indicating the size. In the newborn or the preterms, 5 to 6 French gauze feeding tube is used. Foley's catheter is not used. From infancy, 6 to 8 French gauze Foley's catheter is used. 1 to 5 years of age, 8 to 10 size, and 6 to 12 years, 10 to 12 French gauze size, and then more than 12 years, 12 to 14 French gauze Foley catheter is used. Let's see the indications. So when there is acute retention of urine, you can put the Foley's catheter to check. Then drain urine in unconscious child, and this is used for collection of sterile urine sample, and it can be used to monitor intake output charting. So urine output monitoring over 24 hours in a sick child who is having shock, renal failure or critically ill children in ICU. And during or after surgery this is used, and to relieve the obstruction like in posterior urethral valve or stones, this can be used. And for bladder irrigation by using three-way cannula French gauze Foley's catheter, you can do irrigation when there are cases of hematuria or where there are clots present in the urinary bladder. And for percutaneous cystostomy, this can be used also. This is usually done when the child is having posterior urethral valve. It can be done. Now come to the balloon. The balloon volume of this balloon volume is you inflate by putting water. So in the infants and young children, 3 ml balloon is available. So here you need to instill 1.5 to 2 ml of water to inflate, and in the older children 5 ml balloon is used. That means 5 ml of water should be introduced. So in this channel it is written how much ml water you should be putting. So that much water you can push through the syringe and inflate the balloon. So this balloon will fix the Foley's catheter in place, so the catheter will not get displaced. Now come to complications. There can be urethral trauma or stricture. There can be UTI if you are not doing with the aseptic precautions. There can be hematuria. There can be urinary blood spasm. Now procedure to introduce, the steps how you are supposed to introduce. Always explain the procedure to the child and the parents. Then take the informed consent, verbal as well as written. Then wash your hands and wear gloves. And in case of male, you put the male in supine position with legs apart. Then retract foreskin, clean the glands and meatus with the antiseptic swabs in a circular motion outwards. Then apply lubricant to the Foley's catheter tip. Then hold the penis at 90-degree angle and gently insert catheter until flow of urine is coming to the catheter. Now in case of female will lie in a frog leg or lithotomy position. Then you clean the labia majora, labia minora and urethral meatus with antiseptics. Then separate the labia and visualize the meatus. Apply lubricant to the catheter, then gently insert catheter into urethral meatus until urine flow comes. So after urine flow comes in both male and female, you advance the catheter little bit further, around 1 to 2 centimeter. Then after that inflate the balloon as instructed in this catheter, and then with the sterile water gently you're going to inflate the balloon with the sterile water. Then after that gently pull back the catheter to seat the balloon at the bladder neck. That means it is fixed at that side, so it will not get displaced. Now next instrument is intravenous cannula. So the different parts of this cannula is, it has a stopper threaded over here and it has a needle grip. And there is a chamber flashback where the blood will come out. And there is a needle hub and injector port, so cap. So this cap you can open and then you give injections through this. You can give a fluid through this stopper threaded part you remove, and then you can introduce fluid, the continuous fluid which you are giving, and through this injector port cap you can open and intermittently you can give injections or the medications. And this is a needle proper, and this is a cover, protective cap which covers the needle. So always whenever you take out the needle, always put the cover, and this part is the needle, this is the beveled end. So same thing you can see here. So this is a injector port. Cannula is also available in different sizes. So depending upon the different age, you should be using different size cannula, and then the different colors are indicating the size. So 24 gauge, 22, as the number increases the size decreases. So 24 gauge is the smallest size, 22 bit bigger, so 14 gauge is the biggest size. Now the different side to use when you are putting cannula. In babies and younger children who are not yet mobile, they cannot move much, so in them you can use hands and feet is a good option. So in the hands like this, in the feet like this, you can use the cannula. So dorsum of the hand or even in the side you can use. But for the older children, they are more movable, so hands, arms and anterior cubital fossa is preferable. So this is hand, and then in the cubital fossa also you can use, and arms are used. And over the joints it is very uncomfortable, and then it gets dislodged very soon. So try to avoid the joint areas, and legs are not very comfortable for the older children. Always remember, as a general rule, a single practitioner or single person should not be attempting more than 2 times to put cannula. So if you can't put cannula, After trying for 2 times, you seek for another support or another expert hand. So any expert hand can fail putting the cannula many times. And younger children, you need to use splint. So when you use the splint, the joints are fixed. Joint area is fixed, so the child cannot move the hand, so cannula can be restored for a longer time. Now procedure to put the cannula. Apply topical anesthetic at time of cannulation where available. This is not available in every places. Especially developing countries, we do not use topical anesthetics. You can use any blob of cream over the vein and cover it with a clear film dressing. In the older children, you can use a spray, some cold spray known as vapocoolant spray. And babies less than 3 months, they are usually given oral sucrose just before cannulation to minimize the pain, because they are focused on sucking, and then it is believed that it decreases the pain too. So in the babies less than 3 months, you can use oral sucrose. Now the equipments which are required before you do this procedure. And IV cannulation is very important procedure for every pediatricians. So before doing the procedure, the things required are sterile gloves and apron, then tourniquet to visualize the vein, and then the cold spray or the vapocoolant spray where available, alcohol swab, that is 2% chlorhexidine gluconate in 70% isopropyl. An appropriate size cannula should be selected, either winged or non-winged, and sterile dressing pack should be arranged, and cannula dressing extension set gauze swabs are required, normal saline to prepare for the flush, and then syringe is required, sharp containers and support board splints are required for younger babies. Now how you are going to insert a cannula. So in the preparation, you wear gloves, then prepare normal saline flush by drawing in the saline into the syringe, and use alcohol swab to clean the site. 30 seconds you need to swab and allow to dry for another 30 seconds. Then the cleaning should be done from center of the cannulation site to outward, covering area around 5 or more than 5 centimeter radius. Then you start inserting the cannula. So apply tourniquet first to visualize the vein, but in small babies you hold them tightly and then that acts as a tourniquet, and remove the cannula sheath. Then try to aim for vein which appears straight. Anchor the vein with your non-dominant hand. If you are putting cannula with the right hand, then with your left hand you have to fix the vein from below by gently pulling on the skin distal to the insertion site. If someone is helping you as a tourniquet, then that person will provide upward traction on the skin. Then after doing this, you spray vapocoolant spray from a distance of 15 to 20 centimeter. Then insert the cannula within 15 seconds of applying this spray with the bevel end facing upwards, and the angle of entry should be almost parallel to the skin. Then flashback of blood will be seen in the cannula chamber, which confirms that needle has punctured the vein. Then partially withdraw the introducer needle and the blood enters plastic tubing of cannula. So after this, carefully advance the cannula further into the vein, and simultaneously you have to withdraw the introducer needle until cannula is fully inserted. Then place some sterile gauze underneath the cannula hub. Then apply pressure to the proximal vein close to the tip of the cannula to reduce bleeding. Then gently pull the introducer needle backwards and remove it completely. Then dispose introducer needle immediately into the sharp container. Then release the tourniquet and flush and secure the cannula. So when you secure the cannula, different methods can be used. This method is best for cannula without wings. If the cannula is not having wings, then this method, that is to pass the steri strip under the hub of the cannula, then wrap two ends over top of cannula like this, like a awareness ribbon shape. In the awareness ribbon shape, you just cross the two ends this way and fix the cannula if the cannula is not having any wings. But if the cannula is having wings, then to secure this IV cannula, place a small piece of sterile foam under the hub like this. Then transparent occlusive dressing is applied over the insertion site. So where the needle is, so insertion site, you use a transparent occlusive dressing with a window to view it, so you can see whether there is any swelling occurring or not. Then next step, you use tape as seri strips used as under and over the dressing to further secure the cannula. So under the hub you can take, and over the hub also you can take. So that way you have to fix the cannula. Finally, a protective bandage is applied over the entire dressing to prevent the accidental dislodgement. So this way you can do, and younger children you can put a splint. And always it is good to put a date of placement of the cannula in a strip of tape. In the leukoplast you can just write this date is the day you have put this cannula. Okay, now come to the next instrument, that is the three-way IV cannula. Three-way because it has three sides, three openings, 1, 2 and 3. A three-way IV cannula is used. It provides two additional ports. Extra ports are there to administer different drugs or different fluid. So when multiple channels are required, you can use this cannula. Now let's see the different parts of this cannula. This part is open like this, so this can be connected to the syringe. Connect to syringe or infusion set, so the fluid can go. And there are two additional opening this way. So this one is protective cover, so this one is going to the patient site. So you can attach a cannula or needle, IV cannula or infusion set also you can attach here. And this is a blue control valve. So this blue control valve has three arrows, 1, 2, 3. So wherever this arrow is facing, that part is open. So in this picture, all these three sides are opened. But if you close this, bring this blunt end to this side, that means this side will be closed and this side will be open. So you need to always follow these arrows. And you have a protective cover, you need to cover up this area. So this part, connect injection needle or extension tube. So you can give injection also from this side, or give infusion from this side and injection from this side. You can use either side, but this end will be going to the patient, the vein of the patient. So here you can see this one end, this another opening, this is a third opening which is connected to the patient vein. With the tubing you can do extension tube, or you can directly connect this part to the cannula. If you use an extension tube, dislodgement, chances of dislodgement is less. So now see how it works. So the ports, main port is connected to the IV cannula of the patient. So this will be the main port connected to the vein of the patient. Then you have two additional ports for other devices. So rotating the handle, so this is the handle. If you rotate the handle with arrow indicating the direction of the flow, so wherever the arrow is facing, that part is open, so direction of flow it is indicating. Then fluid control, by turning this handle you can change the direction and open one port to draw the blood and then other port to administer fluid. Then it is a closed system, so it maintains a closed circuit so that it prevents entry of any infections or entry of any additional air, or any contamination cannot occur. It is very safe. Now uses. Use number 1 to give IV infusions. Delivery of multiple fluid channels through a single IV access point can be done. Another use is drug administration via the another port. Another is for blood sampling. You can take blood samples without disconnecting the patient from the IV fluid. Another is aspiration. So from any serous cavities, you can do therapeutic taps like pneumothorax, pleural effusion. So you can do the taps. And then exchange transfusion in case of newborn. When you connect this 3 tap with a 3-way tap, it creates a 4-way tap, and with that you can do the transfusion. So like this, in the exchange transfusion, you connect, these are the 2 3-way tap. So 2 3-way tap is connected this way, and it creates 4 channel, 1 2 3 and 4. So by this you can do the exchange transfusion. From here, infant's blood is taken out and in. This you can do in out from here. This is a syringe, and this is connected to the infant. So infant blood is coming in out. In out is done by the syringe this way, and in this bag the donor blood is attached, and in this bag the wastage, the one you draw from the infant, you should be throwing out. So this is a waste container. So this way you can create a 4-way channel connecting through 3-way tap, 2 3-way tap. You connect and then make a 4-way channel and then do the exchange transfusion. Okay, last instrument, this is tongue depressor. It comes in the plastic material, wooden or metal. So depressor, it is known as spatula also. So the depressor is actually when the shape is like this, C-shaped instrument, or shape is like this, not straight, then this is actually called depressor. The straight ones are spatulas. Uses to examine gag reflex, tonsils, pharynx, movement of palate and uvula. And there are some diagnostic uses. You can diagnose diphtheria patch. You can see the coplic spots, oral thrush, palatal palsy, adenoids, cleft palate, tonsillitis, pharyngitis, retropharyngeal abscess can be diagnosed. And you can even do spatula test. This is to test spasm of masseter muscle in suspected cases of tetanus. So try to insert the tongue depressor between the teeth, then there is a severe spasm of the masseter muscle. So this is known as spatula test. Then you can do cold spatula test. This is done to see the patency of the nasal canal, and this is usually done with the metallic tongue depressor. So if you put a metallic tongue depressor in front of the nasal opening, then mist formation is seen in the metallic device. So that indicates the nasal canal is patent. Then sometimes therapeutic use is there to remove the foreign body. The procedure or how to hold a baby while checking the throat by the tongue depressor. So this position is known as comfort position or even restraining or holding position. So parent and doctor sit facing each other. So doctor should be sitting in front of this mother and child. Then child sits on the parent's lap facing the doctor this way, and parents hold child's arm and body with one hand, providing comfort and security to the child, and with another hand the mother holds the child's head. So the head is gently tilted back, so it is easy for the doctor to examine the throat, and then the doctor examines the throat using the tongue depressor. Okay, thank you. I hope this class was useful for you. I'll be discussing one more instrument class, that will be needles, different types of needles. Thank you.